Tabas. Today we are talking about the role of the pre-implantation genetic diagnostic and the test, and what is the benefit for the patient, and what patient they should do, what's the counseling, what are the uses, what are the problem and indications for the PGD, and is there any other issues which we can discuss. Thank you.
And today we're focusing on pre-implantation genetic testing, or PGT, a powerful technique that is reshaping the landscape of IVF. What is PGT? PGT refers to a group of tests performed on embryos before they are implanted into the uterus during IVF. It helps us analyze the embryo's chromosomes or genes to ensure we select the healthiest one, thereby increasing success rates, reducing miscarriages, and preventing the transfer of embryos with genetic disorders. Let's take a look at how it evolved and types of PGT. PGT began in the early 1990s, initially to avoid transmitting X-linked diseases. Since then, it has evolved into three main types. PGTA to detect aneuploidies, abnormal numbers of chromosomes. PGTM for monogenic disorders such as thalassemia or cystic fibrosis. PGTSR for structural chromosomal rearrangements. Newer approaches like PGT Plus and non-invasive testing are now being developed using culture media and AI-driven embryo imaging, offering the promise of safer biopsy-free methods. So who benefits from PGT? PGT isn't for everyone, but in certain clinical scenarios it's extremely beneficial. Women of advanced maternal age, where chromosomal errors are more likely, couples with recurrent pregnancy loss or implantation failure, severe male factor infertility, donor egg cycles, where even morphologically normal embryos may be chromosomally abnormal, and importantly, families at risk of inheritable genetic diseases. Studies like Young et al. 2012 and Scott et al. 2013 show that PGT significantly improves pregnancy rates and reduces miscarriage. The question that most people may have is, how is PGT performed? Embryos are cultured to the blastocyst stage, usually day 5. A few cells from the trophectoderm, which later forms the placenta, are carefully removed using a precision laser. These cells are then sent for analysis using technologies like next-generation sequencing, array CGH, or real-time PCR. This helps us identify euploid embryos, those with the correct number of chromosomes, which have the best potential for implantation and healthy development. Let's talk about risks and ethical dimensions. While PGT is scientifically robust, we must understand its limitations. There's a small risk of misdiagnosis and a phenomenon called mosaicism, where some embryo cells are normal and others are not. Interestingly, even mosaic embryos may sometimes result in healthy pregnancies, so clinical judgment is key. Ethical concerns around embryo selection, accessibility, and cost effectiveness remain topics of ongoing global discussion. In clinical outcomes and current consensus, the data is compelling. PGT improves implantation and live birth rates, particularly in high-risk groups. It supports single embryo transfers, helping avoid multiple pregnancies and associated risks. For instance, in Scott's 2013 study, implantation rates were nearly 80% with PGT versus 63% without. At the same time, miscarriage rates were significantly reduced, reinforcing the clinical utility of this technology. In summary, pre-implantation genetic testing is a pivotal advancement in the IVF journey, helping clinicians and patients make informed, safer, and more precise decisions. When applied with the right indications and expertise, it can make the difference between uncertainty and success. Thank you for joining me on this episode of Understanding Infertility. I'm Dr. Roya Rozati. See you in the next one.